I'm Dr. Hussein. I have been with Balboa Nephrology for 22 years here in the Imperial Valley, and I'm one of the kidney doctors in this great kidney group. I'm originally from Pakistan. I was trained in Pittsburgh, Pennsylvania, and I have worked as a nephrologist here in the Imperial Valley. It's a very long-term relationship. I sometimes tell my patients that once you have a kidney problem, you're like married to a kidney doctor, and you will be with a kidney doctor regardless who forever. They have kidney problem as a CKD, as a chronic kidney disease patient, and they have to see their nephrologist regularly. And then if they progress to end-stage kidney disease, then they end up on dialysis, and then they are seeing their kidney doctors, and then they get transplanted, and then they are seeing their kidney doctors. So really the kidney doctor remains part of their life as long as they live. A lot of times the kidney patients don't have any early signs and symptoms to make them aware of kidney disease. So a lot of times they get referred by their primary doctor because they realize that they are either leaking protein in the urine, or their levels of in simple word, their levels of toxins in the blood are gone up, but in medical science, BUN and creatinine are up, and that's why their doctor gets concerned. Once the kidney disease progresses, then people start having swelling, or they start having other symptoms related to volume overload, or sometimes shortness of breath. Sometimes their electrolyte abnormalities make them feel sick, so those things then bring them to seek attention, but most of the times they don't have any symptoms until very advanced. So kidney disease has 6 stages. So starting with stage 1, when the kidney function is basically normal and they have just either a little leakage of protein, and then there's stage 2, where the kidney function is slightly abnormal, but still most of the labs would look normal, and a lot of their primary doctors will not recognize that, but it's very early stage of kidney damage. Then stage 3, when their kidney function actually drops below 60%, and then that's where most of people get recognized. And stage 3 has 2 stages within it, stage 3A and stage 3B. Stage 3A is between 45 to 60%, and B would be 30 to 45%. And then stage 4, which when they drop below 30%, and stage 5 is when they are below 15%. Stage 6 would be when they end up requiring a kidney replacement therapy like dialysis or transplantation. The people need to know that there are a lot of chemicals out there that could be nephrotoxic and that can hurt their kidneys, and they should be always aware of whatever they're consuming, that there could some things that could be hepatotoxic, toxic to their liver. So it's good to know what they are consuming and what it can cause. And best principle is to avoid things unless absolutely necessary, and nothing should be taken on regular basis long term without doctor's recommendation. A lot of people like to take multivitamins, especially B complex vitamins, which usually are water-soluble vitamins. They don't store in the body and they get eliminated. So they may be wasting their money on them, but they are not causing any harm with that. But then there are others that are not water-soluble, and they accumulate in the body, and those things one has to be careful. So that's why it's good idea that if somebody is embarking on taking something forever, they should consult with their physician to make sure that they are not doing something that will cause harm to them in any way. Kidney transplant is definitely an option in a person with kidney disease. It gives them, I would call it, give them back their life that kidney disease has taken. So it's the best option for the kidney disease, and as best as we can do for them after having kidney disease, because that eliminates the need for renal replacement therapy. It controls all their volume and electrolytes. It takes care of the anemia. It actually resolves most of the problems. So the only problem which is left after transplant is that they still have to take the immunosuppressive medicine, but that's the only drawback but it's the best second option. If somebody is to have kidney disease, the transplant is the best option in that situation for them. There are different categories of drugs that are used in combination to control the transplant from getting rejected by one's body. Most of the times there are 3 different categories of drugs. They have 3 different mechanisms of action that are used. Some patients can use 2, some have to use 3, depending on how reactive they are to their transplant. And then within each category there are different substitutions based on somebody's intolerance or reaction to the drugs or problem with one of the drugs, and they can be replaced with another one. Mostly they are on steroids. The steroids is only one group, and that will remain the same, except for some centers have done steroid sparing regimens where they are not on steroids. That's the only one option, but other than that, most of the patients always get low dose prednisone. The second category is calcineurin inhibitors. So there are 2 drugs in that group, and they can be replaced with each other. And then finally mycophenolate, again that's one which is mostly used, but in some cases when people have some infections or they have problems, especially from the GI upsets from the mycophenolate, they get taken, that gets taken away, and they do okay without it, but ideal is to be on 3 drugs. Usually it is after they get transplanted, they get adjusted by the transplant center within first 3 months. They usually are on a set regimen of the medicine that they should be taking. Now the calcineurin inhibitors, they interact with other medicines and their levels change. So that's why they are monitored regularly, and then they're adjusted as needed, but that's minor adjustments. And mycophenolate is also fixed dose, so it mostly remains pretty stable unless, as I said, that somebody has some problems with either side effects or they are starting to get some infections, then they can reduce their dose or discontinue. One thing I want to say is that I have had few patients with transplant that unfortunately stopped taking their medicines. And the reason was that the insurance coverage, because after some time the younger people, they don't become eligible for Medicare. And some of them don't have insurance, or they have insurance which doesn't cover the medicines very well and the cost is too high. So I had few young patients who just stopped taking medicines because they couldn't afford them. They ended up on dialysis again. So that's a very critical thing for, I think, the patients to understand that is very important. I do understand if they can't afford it, but that's unfortunately our system. Well, I think the most important thing is that most of the patients who are on transplant list, they are on dialysis. So they need to be really compliant with dialysis. They need to stay regular. They need to follow all the instructions, maintain their volume, blood pressure, make sure that their phosphorus is running good, and everything else their doctors recommend them to do, depending on their condition, they should do to prevent further progression and damage to their body, because otherwise a lot of patients they enter dialysis and they are completely candidate for transplant, and by the time they are time to get transplant, they are disqualified. I think a lot of people don't understand and they're afraid to donate. But I think that living donation should be a big thing. Definitely, if somebody knows somebody who has kidney disease, they should be encouraged to donate if they are healthy people. Also, I think that there should be a big push towards people agreeing to donate their organs when they die. I think that should be also encouraged. A lot of people are afraid of that or don't understand that very well, and they just don't mark that on their driving license. So I think that there should be more education that people should be able to donate, and it's not only kidneys, there are other organs that can be donated too, and which can help some other person. And it's two way of looking at things. Nobody wants to die, so I think that's another way of living.